Hi, thanks for being at my presentation. I'm excited about this topic because price transparency and comparison shopping technologies have the potential to bring about big changes in healthcare. So let's see what this hoopla is about. To see the point about price transparency, let's look at a patient's visit to a doctor. Say a patient has severe swelling or angioedema and is prescribed medication for 4 weeks. However, a full prescription will cost $1,800, which the patient cannot afford. So the patient orders just 1 week's supply and decides to split the pills. Research has shown that many patients are deterred by costs of prescription drugs, which leads to a big adherence problem when patients alter doses or skip certain medications in the prescription. Self-dosing and self-medication can have severe health consequences. The level of price variation for healthcare products and services far exceeds the variation found in other products, as shown in this example, of a drug that is used to treat ADHD and narcolepsy. In the absence of price transparency, drug producers and sellers can not only charge higher prices, but they can also willfully alter prices by day, location, buyer type, and so on. We studied price data for hundreds of drugs and found that often merely changing the formulation, say from tablet to capsule, can cause a tenfold change in price. As healthcare costs approach 20% of our GDP in the US, there are many movements towards price transparency by government, technology entrepreneurs, and industry. And the good news is many healthcare services are shoppable. Think about the comparison shopping you do when buying a smartphone or storage device or Instapot. If information technologies could provide personalized prices and substitute products, could healthcare become like comparison shopping for a smartphone on Google or Amazon? Maybe, but there's a big problem with this analogy. Patients, the consumer in healthcare, have little ability to act on data about prices and substitute products because they do not understand the price-quality fit and trade-offs involving alternative choices of medications or labs or hospitals. The right context for price and product data is for it to be jointly examined by a patient and a trusted expert, most likely their physician. Technology companies have begun introducing systems that provide such data within the EMR so that it can be part of a cost of care conversation when a patient visits a doctor. But that is easier said than done. Doctors have to be trained to have such conversations, incentivized to take out the time to do so, and patients have to trust that cost-related advice is in their own interest. Technology should force sellers to compete more aggressively. So would that bring prices down? This question came up 3 decades ago when the internet suddenly made comparison shopping easier by reducing buyer search costs. The initial belief was that comparison shopping would cause prices to fall and be similar across stores. But the reality is more complex. Scholars found evidence of persistent price dispersion in online markets for many reasons, including transaction costs, product variety, perceptions that price reflects quality, and so on. Sellers could react to price pressure by increasing consumer targeting and segmenting. So some consumers will pay higher prices than before, and others pay lower prices, but possibly for lower quality products. And sellers could be forced to reduce investment and innovation towards building new and better products. Widespread use of comparison shopping should cause a redesign of insurance plans. Today, patient co-pays are usually constant amounts. This makes sense since patients do not have price information when making their decision. But with comparison shopping, patients can have an incentive to switch to cheaper choices, but only if cheaper alternatives cost them less, versus just being cheaper for the insurance company. This can cause more insurance plans to set copay amounts as a percentage of actual cost, creating greater risk for patients. The current model is that price transparency technologies are financed by payers, the big insurance companies. But payers will adopt or invest in these technologies widely only if 1. There is a high degree of price dispersion, 2. They are highly accurate in listing prices and substitute products, And three, there is a high willingness among patients and doctors to accept the recommendations and switch to cheaper alternatives. If these necessary conditions are met and these technologies are priced reasonably low, then in fact they will be widely used. But here's the paradox. If price transparency technologies are widely used, then the high degree of switching away from costly alternatives should cause sellers to alter prices, leading to a low degree of price dispersion in the market, which would then make the technology itself less necessary. How do we escape the paradox? There are three possibilities. First, these technologies do not actually cause a big reduction in prices or in price dispersion. That's possible, as we have seen. Two, they are priced high and therefore remain exclusive to some buyers. And three, they turn to sellers for financing in return for preferential placement, like the sponsored results that we see in the search engine industry. Indeed, as we have seen in other instances, such search and comparison shopping technologies can be so successful that rather than just being on the sidelines of the market, they become a core aspect of market functioning. Essentially, they serve as gatekeepers and amass so much market power that they thereby threaten the role of producers and sellers in the market. Many things will have to go right in order to realize the benefits of price transparency and comparison shopping technologies. Our experience in other industries with similar technologies suggests that policymakers will have to be on guard, both to ensure that these technologies have a chance to succeed, but also to ensure that they do not become too powerful and dominant. Thank you.